Hi students, welcome to the session of oral pathology. We are discussing bone tumors, and in this video we will discuss about osteosarcoma. Okay, osteosarcoma is a very important topic for your NEET INCT exam. There are certain things you should know in osteosarcoma. What you know about osteosarcoma? It is a malignant tumor of your bone, right? It is a malignant tumor of your bone. Okay, and that is the most common primary malignant bone tumor. Primary malignant bone tumor, that is your osteosarcoma. So why I write primary here? In certain textbook, it is said that the most common malignant tumor of bone is multiple myeloma. And in some textbook, it is written that the most common malignant bone tumor is osteosarcoma. Actually, multiple myeloma is a tumor of your plasma cells. Means this tumor belongs to that bone marrow. But you know, bone marrow is within the bone. So anyway, this multiple myeloma presence in the bone. Right. So there is two school of thoughts that some school of thought say that multiple myeloma is the most common malignant tumor of bone. Some textbooks say that no, it is osteosarcoma. You don't worry about that. Such controversial questions they will never ask you. But if they ask this term primary bone tumor, okay, primary bone tumor means that the primary bone cells, okay, means the cells primary to your bone, that is your osteoblast. Okay, the most common primary bone tumor is osteosarcoma. Either it be in the adult or in the children. Okay, primary bone tumor in children is again osteosarcoma. Primary bone tumor in the adult is osteosarcoma. So just look for the term primary. Okay, so that is one thing. Okay, this is a controversial question that students are discussing and fighting for years. Okay, so just think that they won't ask such controversial questions for you. Okay, now what are the most common features? Which are the features we should know, clinical features, and what is the most common location? What is the most common location for this osteosarcoma? It is your long bones. It is your femur, or we say distal femur and your proximal tibia. Okay, distal femur, proximal tibia is a most favorite site for this osteosarcoma. But what we are considered about the jaw actually, and 6% of the cases they comes in the mandible. So mandible is more favorite site than maxilla. When we consider the head and neck or the oral cavity, mandible is more favored for osteosarcoma than the maxilla. Okay, that is one thing. Now, what about the features? The radiographic features are very much interesting. You may have heard about the classical radiographic features of osteosarcoma. That is your sun-ray pattern, sunburst pattern, right? All these patterns you may have seen. Codeman, there is a term called Codeman triangle, right? So let's see what are these. Okay, let's see in the picture and then we will understand more. Okay, so I have a radiograph here. I hope you can see the radiograph here. Okay, I have a radiograph of your femur part, okay, distal femur part, and you can see that there is a lesion here. Here also there is a lesion, and you can see that there is radio opacity is radiating from that lesion. Okay, there is a swelling, and you can see radio opacity is radiating from the lesion. That is called a sun-ray pattern, or we say sunburst pattern. A sunburst pattern, sun-ray pattern, or sunburst pattern. Or actually, these things are very difficult to be seen in the mandible, but you can rarely see. This is mainly seen in long bones. Okay, sun-ray pattern, sunburst pattern, Codeman triangle. Now, what is Codeman triangle? How you see a Codeman triangle is that, so whenever the bone has a lesion, okay, so I have a bone. Imagine that this is a bone, and above this bone I have a periosteum. So I will draw the periosteum here. Okay, I have a periosteum here. Now what happens that whenever there is a swelling which is happening, or a lesion which is happening in the bone, it will push this bone, right? It will push and expand the bone. Now what happens is that when the bone is expanding, what happens here is that, okay, so the bone is expanding here. Okay, this periosteum gets separated from here. Okay, so this lesion is pushing this bone, and it is expanding. So what happens, the periosteum is expanding, periosteum is separated from there. To keep the contact with the bone, the periosteum will start depositing bone here, right? To keep a contact with this bone. So this periosteum will raise a little, and to keep the contact with bone, it will start depositing, and that raised portion of the periosteum will form a triangle, will form a triangle-like structure. Okay, that raised periosteum, this raised periosteum will form a triangle-like structure that is called your Codman triangle. Codman triangle. So Codman triangle is not a particular thing in osteosarcoma. It can come in many other lesions also. Okay, whenever there is a swelling in the bone, whenever there is a periosteal separation, there is a chance of getting a Codman triangle. It can come in Ewing sarcoma. Okay, it can come in other lesions also. Okay, whenever there is a swelling, whenever the periosteum separates from the bone, okay, periosteum is very much attached to the bone. They are in deep attachment. Okay, there is very good attachment of this periosteum with bone. So whenever there is a separation because of this swelling which is growing from inside, what happens? This periosteum gets separated. So periosteum, when they get separated, to maintain the contact with bone, they start depositing bone, and they make a triangle-like structure there. That raised periosteum part is called Codman triangle. Okay, so simple concept. Right. What else you can see in the radiograph of a osteosarcoma? So you see sundry pattern, you see a Codman triangle. Okay, those all things you have seen. Now, what next you can see? Codman triangle is in. Now, in the mandible, you can see interesting structure that your root will be resorbed. Whenever you have osteosarcoma in the mandible, all the tooth root will be resorbed, and that resorption is called a spiking root resorption. Spiking root resorption, the root will be resorbed, and you can see that the PDL space will be widened. Periodontal ligament space will widen, and that is symmetric in all tooth. Okay, it is called a symmetric widening of PDL. Symmetric widening of the PDL space. What is that symmetric widening of the PDL space called? There is the term we use for the symmetric widening of PDL space is called Garrington sign. Garrington sign. So this is one thing, Garrington sign, symmetric widening of PDL space, and that is actually a early thing we can see before the starting of the expansion, before the starting of Codman triangle, before the starting of the sundry pattern. You can see that there is a symmetric expansion, symmetric widening of the PDL space, and it is called Garrington sign. It is an early sign. We call it as an early sign that, oh, osteosarcoma is coming. Okay, so cement widening, the PDL space of all the tooth will be widened. Okay, so these are all the features of your osteosarcoma. Now, if you take the histology is not that important. There is so many variants of what osteosarcoma is there. Out of this, certain names you should remember according to the content of this osteosarcoma. They are classified into fibroblastic. Means if the osteosarcoma has more of fibroblast and collagenous content, we call it fibroblastic osteosarcoma. If the osteosarcoma makes some cartilage also, okay, the osteosarcoma, if they make some cartilage inside, we call it chondroblastic osteosarcoma. If they are making more of bone itself, we call it osteoblastic osteosarcoma. There are many other subtypes that is not that important. If the osteosarcoma has so much of blood vessels, we call it telangiectatic osteosarcoma. If the cells are very small, we call it small cell osteosarcoma. So many histological variants are there. It doesn't matter. Only one thing you should remember: on the jaw, in the oral cavity region, in the jaw region, which histological variant is more commonly seen? Your chondroblastic osteosarcoma is most commonly seen in the jaw region. Okay, in the jaw region, which is most commonly seen, chondroblastic osteosarcoma, where they have a little amount of production of cartilage also. Okay, so that is about the osteosarcoma's histological appearance. Okay, so that nothing much is there, and this is about your osteosarcoma. They won't ask you much more in osteosarcoma and trouble you. Okay, so I hope you understood osteosarcoma. See you in the next video with a new topic.